Alors, bonjour à toutes et à tous. Bienvenue à ce...
Good afternoon, everyone. Welcome to this press conference with Premier François Legault, Health Minister Christian Dubé, and Health Director Dr. Horacio Arruda. Mr. Premier, the floor is yours.
Bonjour tout le monde.
Good afternoon, everyone. I hope you had as good a weekend as I did. I looked at the numbers, so that made me smile all weekend. And so the numbers are good. The trend is good. We are seeing a decrease in cases, a decrease in hospitalizations. The rate of positivity is at 2.3%. Just to give you a comparison, in Ontario yesterday, they were at 6.2%, so more than double. The vaccination team is continuing to do extraordinary work. Quebec is the top province for the percentage of the population that's received the first dose. So congratulations to Christian and the whole vaccination team, and congratulations as well to Quebecers. Quebecers are answering the call. Quebecers of all ages, so I'm truly proud of the response and the solidarity of Quebecers. I want to say a word on the people from the Beauce region. We saw that the past few weeks were difficult, but when we look at the numbers over the past few days, a huge improvement in the Beauce and in that region, in HMA. So congratulations for this turnaround. This said, the reopening plan that we announced last week can begin. So, of course, we will be prudent. We will progress slowly, but as expected, this coming Friday, the 28th of May, restaurants, well, the patios of restaurants will open throughout Quebec. We will remove the curfew throughout Quebec, and also gatherings in backyards will be permitted for a maximum of 8 people. I know, and I'm the first one who's following the weather for Friday night. It's going to be 16 to 17 degrees in Montreal. It's a little bit cool, but it's better than nothing. And so we will be able to gather with some friends, so that's great news. The second step is next Monday, the 31st of May. As announced, most of the regions will go to the orange alert levels. So we've got the Capitale Nationale, the Montérégie, the Laurentians, Lanaudière, and the Outaouais. They will all go to the orange level. That means essentially that all high school students will now go to school full-time. The restaurants, so the dining rooms in restaurants, will reopen. Gyms will reopen as well. There were already some regions who were in orange or yellow, so that doesn't change. So that means that there are 5 regions remaining, and they're under monitoring. So Chaudière-Appalaches, I mentioned it earlier. The situation is improving. The greatest part of Chaudière-Appalaches is going to orange, but there are 4 MRCs where we want to wait an extra week. So Montmagny, Lillet, Beauce, Artigan, and Robert-Cliche. In the Estrie, the entire region will go to orange, except for the MRC Le Granit. And in the Lower St. Lawrence, well, the east will go to orange. That means Rimouski, Métis, Matane, Matapédia. However, the 4 MRCs in the west will stay at the red level for another week. So Rivière-du-Loup, Basse, Témiscouata, and Kamouraska. For Montreal and Laval, Public Health had some discussions with the representatives of public health in these regions. We prefer to be prudent, and we will leave these 2 regions in red for 1 more week. But I want to tell you that even in the 5 regions or sub-regions where we are staying in red, the situation is improving. We are optimistic, and the objective is that the following Monday, so the 7th of June, all of Quebec will be in orange. I will end with a message for young people. We know that older people have surpassed our expectations. They've surpassed the 75% vaccination rate. For young people, we're off to a good start. There was a very good start, but we're not done yet. So I'm asking if they can do so today, please register, go get vaccinated, make your appointment. And I think that Quebec needs your solidarity so that we can continue to win. So thank you in advance.
Good afternoon, everyone. Our numbers continue to decline, and we're currently the province that vaccinates the most. I'd like to congratulate our teams as well as all Quebecers for their solidarity. I'm really proud of Quebecers. So we're moving forward with our gradual reopening plan. As planned, everywhere in Quebec starting this Friday, restaurants, terraces will reopen, the curfew will be lifted, and outdoors gatherings of 8 people will be allowed. Starting Monday, as planned, the majority of regions will turn orange, including Capitale-Nationale, Montérégie, Laurentides, Lanaudière, and Outaouais. There are still 5 regions under surveillance. First, Chaudière-Appalaches will turn orange with the exception of the MRC of Montmagny, Lillet, Beauce-Sartiguan, and Robert-Cliche. They will remain red. Estrie will also turn orange with the exception of the MRC du Granit. In Bas-Saint-Laurent, Rimouski, Lamitis, Matane, and Lamatapédia will turn orange, but Rivière-du-Loup, Les Basses, Témiscouata, et Kamouraska will stay red. In Montreal and Laval will stay in red for another week. But even in red zones, the situation is improving. If we continue this way, all regions should turn orange on June the 7th. I'll end with a message for young people. Vaccination is going well, but we must continue this way. We need your solidarity to continue to win together. Thank you.
Merci. Nous allons
Thank you. We will begin the question period.
avec Patrick Belrose, Journal de Québec.
Oui, bonjour à tous.
Question. Hello, everyone. Mr. Premier, perhaps some precision on Montreal and Laval. The number of cases doesn't seem that high, 150 approximately per day. What are the indicators that make it so that you have chosen with public health in Montreal to report for a week or to delay the reopening for a week? We have to understand that we can't necessarily just reach a level. We can reach it, but it must be a trend that is sustained for a certain period of time. The numbers in Montreal are improving like in Laval, and I would say that the curve is going in the right direction, which means that we will truly be in the lighter colors, lower levels, so that's what's happening, because that trend is very recent. So, for example, it's been a long time that Laurentides, Lanaudière, and Montérégie were in the orange zone, but we were waiting for this stability. And the hospitalizations, perhaps, as well? Well, it's one factor that we look at, but still, we have to say that the situation is improving throughout Quebec, and that's a good thing. Mr. Premier, it seems like we had a bit of a little taste of the reopening in Cap-Saint-Jacques and Oka. And what do you expect next Friday when we start reopening? Are you afraid that there will be some exaggerations? And what guidelines are sent to the police? We saw this weekend that the police wasn't very present. We let young people party a little bit. So what guidelines do you have for the weekend? Well, the guidelines for the police officers does not change. We want to continue to have the measures respected. Obviously, this is one of the reasons why we're proceeding gradually. So whether it's in Montreal, Laval, or in some sub-regions, we don't want to open up too quickly. So that is occurring over a few weeks. When I talked about small parties, and it rhymed with été, petit party, so we're not yet in the summer yet. That's the 21st of June. So we have to be careful. We can't see what we saw on the beaches this weekend. We must continue to be prudent if we want to continue to be able to reopen and deconfine as outlined in our plan. Question. Hello. Question for you, Mr. Legault. I would like to hear you on the state of emergency. We heard Mr. Dubé last week talk to us about some advantages when it comes to the payment of premiums for employees in the healthcare system, but there are some people who think over the past few days that it's not a good enough justification, that the emergency measures is an exceptional power. So is there a time as of which you will let go of the state of emergency, and what will we need concretely? Are there objective indicators? Well, first, what we have to remember is that in the emergency measures, there's all of the guidelines, the wearing of the mask, physical distancing, the closure of parks when things are exaggerated. We have said we don't think that we will be able to truly deconfine and remove all measures before everybody has had 2 doses of the vaccine. And we expect that this will be done approximately around the end of August. So it would be impossible to remove all the emergency guidelines or measures before the end of August, to be realistic. Okay. Now, concerning the administration of the vaccine to the 12 to 17-year-olds, there are some people who are saying that instead of administering these doses to the 12-17s, we should administer a second dose to vulnerable people. I understand that in the CHSLDs and the RPAs, this is already being done. What about the other vulnerable clienteles? Could we shorten the delay instead of vaccinating the 12 to 17-year-olds right away? Well, what I would say is that one doesn't prevent the other. We can do an acceleration, as we're doing now with our vulnerable people. We have said we have already done the CHSLDs. That's been completed. We are doing the RPAs currently, and that will be done for the 31st of May. We have said that we would accelerate what we call intermediary resources for home care. So we're able to do all of that. And actually, we have asked Mr. Parré's team to make sure that we could go even quicker. I'm thinking about the HLMs, amongst others, so they're not mutually exclusive. The good news is that with the number of doses that we've got with Pfizer, we can accelerate the program for vulnerable people and vaccinate our 12 to 17-year-olds. So that's good news. Question? Hello. Once again on vaccination, Mr. Dubé, you just said that you can accelerate the administration of the second dose. So people 70 and up, will they be able to make a new appointment to accelerate the administration? How will this work exactly? Well, what we have asked, and first of all, we're concentrating on the first dose, right? Everybody is aware of this with the 12 to 17-year-olds. But given that we will have an important number of Pfizer doses in June, what we have asked Mr. Parré, and we have to do this with Clic Santé, and I'll get back to you, I hope, within a week. And we will allow, and Clic Santé will allow people to accelerate their appointment. So let's say somebody had their second dose in September, for example. Well, what we'll do, and I would say that it's a question of perhaps a week, this will allow us, when we have a good idea of how we can do this, somebody will be able to go on Clic Santé and say, I'm canceling my previous appointment and I will take a new sooner appointment. It's going to be done by age group? Yes, of course. We have to respect the same principle. Our objective actually is very simple. It's to bring all the second doses of September, bring them before the end of August. That's the objective. Second question on vaccination. Dr. Arruda, perhaps, concerning the efficacy of the vaccines, because we've heard quite a bit that after a first dose, the efficacy of the vaccine, according to the type, depending on the type of vaccine, was 92, 95%. But it's not that. It's 50%, but 92% when we have the second dose. What about? Well, it still remains around between 80 and 95% for the first dose. We have to understand, because when we talk about general efficacy, we're talking about there could be some people, for example, who are immunocompromised, some people who have kidney illness, for which the efficacy will not be 85%. It could be 50% or less. So we really have to look at the category. But we know that a first dose protects, particularly, not necessarily from the illness, but it protects against complications and hospitalizations. We see quite well, as well, that as soon as we've given the first dose to many people, the rates of hospitalizations with the elderly and the deaths had already started to go down. Now, the issue is in order to be able to maintain this immunity, we need a second dose. That's quite clear. And I would tell you that the studies are confirming, I think the strategy of having administered a first dose to everybody, the 16-week delay, saved a lot of lives, because otherwise there would have been some deaths for the people who were not vaccinated. Now, according to depending on the availability, we will we will shorten the delay. For example, with AstraZeneca now, we know that even if the manufacturer had said that it's 28 days, it's 12 weeks. The long-term protection is most efficient at 12 weeks. So it varies from one vaccine to the next. But overall, the vaccines that we've got currently have good efficacy. Question? Mr. Arruda? For AstraZeneca, many Quebecers have heard the government's message to go get these vaccines, who feel like they were fooled a little bit and they're worried about the second dose. So how can we reassure them? And what will be that second dose? Will it be AstraZeneca or something else? Well, the sick still has the same position. I'll summarize it. Now, for the fact that these people feel fooled, these people who received AstraZeneca, 500,000 doses that we administered approximately, they were protected. They could have had COVID-19, and we are convinced that we saved some lives. We prevented hospitalizations and long-term complications for this clientele. So they were not fooled at all because they would not have been vaccinated at that time. Now, for the second dose, what is recommended currently, unless we're below 45 years of age, but if you're above 45 years of age, is to get the same vaccine, the AstraZeneca. The complications that were reported for the thrombosis, 1 out of 100,000, are way lower, much lower, 1 out of 1,000,000 for the second dose. So the probability that you will have a complication is very low. However, nobody will require that somebody gets the AstraZeneca. If the person consents to this, we can offer an RNA vaccine. We can mix and match of vaccines if people don't want to get AstraZeneca, and we will inform them. When we change a type of vaccine, we have a greater side effects. We can have a fever, chills. We can be sick for 2 to 7 days, as if we had a good cold. It's not just a sore arm. It's much more intense. And the frequency, which usually is at around 10%, can go up to 40, 50% for these side effects. So people will get the information and the choice. We are still waiting for data on what was done elsewhere in the UK, etc., to verify the effect. But the hypotheses that we have right now is that if we change a vaccine, there is still a good response, but more side effects. Will there be enough AstraZeneca, or will some people have to change a vaccine? I found out this morning from Mr. Paré that we could get additional doses of AstraZeneca, because you'll remember that a week ago I had told you that we had 148,000 available. But from what I understand, given the opinion, we will be able, if more people want to get their second AstraZeneca dose for the reasons that Dr. Arruda told us, they'll be able to get an AstraZeneca. Question? Mr. Premier, you gave a timeline for us to get to an agreement with the collective agreements with the public sector. We're almost at that deadline. Are you thinking about a special law in order to settle quickly this issue of collective agreements? No, we are not there. We are in negotiations, and they're ongoing. I'm told that it's progressing well at the different tables with the nurses, amongst others. So as long as the negotiations are going well and that there are no pressure measures, well, we will continue the negotiations. Our objective is truly to come to an agreement that is negotiated. Now, since we're reopening, and there are already some people who are thinking about back to school. In the colleges and CEGEPs and universities, there's a lot of students who got used to learning online. So will back to school be mandatory, or will we accept hybrid methods? That could help a lot of students in CEGEP and university. I can tell you that the objective is that everybody in the CEGEPs and universities will go back to class. Of course, we're waiting for the okay from public health. Now, when it comes to the distance, the distance between students in class, but the message that I have for students, those who need to move to go to CEGEP or university, well, find an apartment because you will be in class.
Olivier Bossé, Le Soleil.
Question? Hello. On the parties that we saw this weekend in parks, is there a form of tolerance by saying, well, these young people, we'd rather they be outside than in apartments or basements? Well, we prefer when they're in small groups, and they must respect the public health measures. So we don't want to choose. Obviously, there's less risk outside than inside. But, not respecting social distancing in groups unless we live together, that's really not a good idea. And police officers will disperse the crowds when necessary. Now, on the importance of the second dose, we can see that everybody is so anxious to get their first vaccine. How do we convince people that it's not over? The second dose is important, and we can't just reopen up everything at once. What are the tools that you will use? I think that the main tool, and we've said this, the 31st of August, somebody will be completely vaccinated. That's what we want, and people need to understand this, because when we will want to look at the benefits of vaccination, well, it's a population that is adequately vaccinated. That means 2 doses. Now, what I'm very pleased to see, even in the past 24 hours since we've opened up to 12 to 17-year-olds, we have close to 100,000 appointments that were taken in less than 24 hours for our 12 to 17-year-olds. So that's out of a population of approximately 600,000 people. And that doesn't take into account what we'll be doing in the schools. These are people who either took an appointment themselves or they did it with their parents. So I think the demand for the first dose is very strong. And once people realize that there's a second dose that goes with that, well, I think, well, that's why the date, I'm coming back to this, the date of the 31st of August for me is very important. The 31st of August, we want to have the first dose and the second dose administered. And obviously the addition, that's what the additional vaccine doses allow us to do now. When we prescribe a medication for 10 days, let's say an antibiotic, if we only take it for 5 days, chances are good that it's going to come back. The illness will come back. Now, if we reach a good immunity with 80% of people who are vaccinated, but over time it decreases and we find ourselves with 20 and 30s, what do you think is going to happen? The virus is still present, right? There are some people who are still dying. I don't know. So the virus is present, and the freedom that we're giving ourselves through this reopening plan, we can't mess it up by leaving everything aside, by abandoning everything, because that's what will happen. And I think that we are able in Quebec to reach good vaccine coverage. I think that is a solution, and all Quebecers will be able to respect the measures. I'm convinced of this. It's important, and it's not just for fun that we tell you not to gather indoors right now. It's because the vaccine coverage is not there yet. And we have to understand that the virus is still present. It's low, but some curves have started going back up after they were flattened, and we saw this in the past.
La Presse.
Question? Mr. Dubé, I'll make you repeat. When it comes to the second dose, am I to understand that we are considering accelerating the administration of the second dose, for example, for elderly people who live at home? So these people are included in what you're saying, and how will we proceed? You talked about Click Santé, but when can they expect to get their second dose, for example? What we will do is that we will announce a detail of all of this. On Thursday with Mr. Paré, we always provide an update on the vaccination campaign. What I've asked Mr. Paré for Thursday is to explain how this will occur. The principle that I'm giving you today is that we are able to accelerate the administration of the second dose independently of what we're doing for the 12 to 17-year-olds. I think that's what worried people. Why are we pitting one against the other? But we can do both. And I will give you the details of this with Mr. Paré on Thursday. You brought up young people. We've got some work, but there's still more work to be done. For the 18 to 29-year-olds, are you satisfied with their response? And will there be new initiatives to attract them and encourage them to get vaccinated? Well, we would like things to go quicker, but I think that things are going quite well. I'll give you some stats. I'll take the 18 to 24s and up to 40. Up until now, after 10 days, you'll remember that we started that group a little over 10 days ago. The average for these 4 groups is at 65%, which is huge. So if we take this group and I compare it to how long it took in the other groups to get to 65%, we're exactly in the right place. So I would not be surprised if in a week or 10 days, while we're doing the 12 to 17-year-olds, that we will go up to our 75% for these 4 groups. So, we follow this very closely. Will there be additional measures? I only look at the walk-ins, right? We've added in Quebec last weekend the walk-in appointments, and we've added some in Montreal as well. So as soon as we have the capacity to do walk-ins, I get the impression that within a week or so, we'll be able to do walk-ins in all of our establishments in Quebec. So that is part of our way of reaching more people in this age category, the 18 to 24 and 24 to 29, much quicker. But things are going really well. So all the establishments in Quebec, you're talking about all the vaccination clinics? Well, I would say if I take a region like the Montérégie, we would like to have, for example, 1 or 2 centers that allow to do walk-ins. We can't do walk-ins everywhere because it's difficult. But I would tell you that in our 17 regions, that's what I should have said, we will be able to have at least 1 place where we can do walk-ins.
Merci. Je donne maintenant la parole à 2 journalistes à distance. D'abord, Mylène Crête du Devoir.
Question? Hello. I'd like to know, Mr. Arruda, you said that there are some curves that have increased after they were flattened, and that we've seen this in the past. Should we be concerned about a 4th wave, possibly, with the reconfinement measures? I think that with the measures that we're putting in place, with the increase of the vaccine coverage, we should be able to control the situation. We could have some small increases, but not necessarily a big outbreak. The question of the 4th wave would probably be associated to a new variant, or to a variant for which the vaccine that we're currently giving would not be effective. That is always a possibility. And, coronaviruses mutate. Right now, we're confident that with the vaccine coverage that we have and will have, with the measures that people will respect because they understand that it's important, they don't want to play the movie back again. Nobody wants to do this, so we're giving ourselves some freedom. There's a seasonal effect as well, which will have an impact. So I think that we can get to the fall without fearing an important outbreak or increase in cases. Question? You saw gatherings in parks this weekend. These people, or the public in general, can they catch COVID-19 outside like that? Well, listen, the risk is much lower outside versus indoors. We know that indoors, and that's why we still prohibit gatherings. People are not looked at. We forget that we're in a context of COVID-19. People don't wear the mask. Outside, we have heard, even if we say that the risk is much lower, we heard stories about people who gathered in a park, and we can very easily, get closer to each other. So if one person carries a virus, the other person can catch it. The risk is lower. And I would hope that people will still be able to take advantage of the outdoors, because outside we can still be in a bubble and with other bubbles within outside of a distance of 2 meters. When we apply these measures, if we wear the mask, especially if we're with people from outside our bubble and we're traveling and moving around with hand hygiene and all of that, I think that we'll be able to avoid big outbreaks. But there's always a potential risk.
En anglais maintenant, Raquel Fletcher de Global, toujours en ligne.
Good afternoon. I wanted to also ask about, Marika, there's some feedback. Can you hear me okay?
Yeah.
Okay. I wanted to ask about the 2nd dose as well. Just maybe, I know that I'm making you repeat what you said in French, but you say there will be enough AstraZeneca doses for those who would like to get their 2nd dose, and that choosing to have a different vaccine could create quite an important reaction, a significant reaction in people. Can you explain how you're going to address those two issues?
Well, maybe I can start with the first part. I think we have two groups that we need to make a difference between for the second dose. First, the group that I was talking about is all those vulnerable people that we have to get vaccinated with the second dose. We have done very well with CHSLD. We're doing the RPA right now that will be finished by May 31st. And we've asked to accelerate the people that are in HLM, in RRI, ressources intermédiaires. And so I think this is clear that we want the people that even at home that they cannot go to their second dose, that we will make sure that we find a way to accelerate the vaccination of the second dose. I will provide the details with Daniel Paré of that on next Thursday. That's the first thing. The second thing is to deal with how do we accelerate the vaccination of the people that have their second dose appointment, for example, in September. And I think with now the good news with the new vaccine, the additional vaccine that we have from Pfizer in June and July, we will be able to accelerate those appointments. Now, to make sure that this is well organized, we've asked Click Santé to provide us the way on the website to make sure that that a person can cancellate, say, her or his appointment on September and advance it with an available date in August, for example. Because our goal, in summary, is to have everybody being vaccinated prior to August 31st. So those are the two categories that we are working on.
Dr. Arruda, would you like to add?
No, in fact, I think that's exactly what is the case. And as I was telling, we're going to have AstraZeneca for the ones who want AstraZeneca, and if the people don't want AstraZeneca, they will be able to have another vaccine, but we will explain to them exactly what are the side effects when you have a mixed calendar.
Okay, my second question is for Mr. Legault. Today is the 1-year anniversary of the death of George Floyd, and this morning the Committee on the Future of Policing tabled their report on how to modernize Quebec police forces. Are you happy with what you see in that report?
Okay, we just received the report today. Geneviève Guilbeault will give our reaction tomorrow. So, of course, it's an important report. And one of the problems we have to address is exactly this point about how police hack with people from different communities. So we'll study and read the report and give you our comments tomorrow.
Pouvez-vous répéter en français votre réponse?
Can you repeat your answer in French, please?
Oui, donc on compte prendre
So
connaissance du rapport.
we will read the report today, and the Deputy Premier will react tomorrow with our comments on this report. Clearly, one of the points that will be looked at is the entire question of racial profiling. How do we eliminate this within the police forces? I have not yet read the report, but this will be done.
Good day. We are getting incidental reports of some teachers and professors telling CEGEP students and university students that they should expect to be doing their classes online in the fall, next fall. Is that a possible scenario, or do you envision students in those levels will be physically present in schools in the fall?
Okay, so far, the only restrictions we have right now from public health is about the distanciation between the students. But all lesson courses where we can have this distanciation will be done in presence of the students. So we have to expect that the vast majority courses will be given in presence of students.
Okay, thank you for that. And a small question for Dr. Arruda. You're holding off on Montreal and Laval. They're staying red till June 7th, from what I understand. What will it take for them to go to the orange status? You said you were looking for a tendency, a trend.
It's the tendency that will go down again. I would tell you, but before we waited for I would say for at least 14 days, they stay in that level. Probably because there is more vaccination, probably because the slope is going very fast, we will be able to put them orange soon.
Are you sure you're going to hit the 7th, though? Even that?
I think there is always, with epidemiology and with the virus, surprises that could happen. We are projecting that it's going to be good. There is a good chance for it. And that's what I can say. But I cannot guarantee, I will not offer you a 1% guarantee, because life is life. And but I think we want to tell people, because we want to give them perspective, which was, I would say, easier now that we have vaccinated people than it was in the spring, because we didn't know. And the tendency is, it's been stable for a long time in Montreal, and now it's going down this way. It's the same thing in Laval too. So if the two regions, and because even if we test less, there is a low positivity test, we have not seen higher, so we think that's a real effect.
Thank you.
Katsune, CBC.
Good afternoon. Radio-Canada has done an interview with Daniel Marino, the owner of the Mega Fitness Gym. And he says that he doesn't feel that much guilt. And he will reopen on Monday. Can I ask you your reaction in French and in English, having some news from Daniel Marino today? Et compte tenu du fait que ce gym-là est
Given the fact that that gym created 500 direct and indirect cases, well, we have to see what are the implications, because he didn't respect the law. I admit that I don't know exactly right now, but the gyms technically in Quebec can reopen on Monday. They must respect the rules and the measures. Now, what are the impacts of what was done that was illegal? Well, I would have to ask the question to the people who are concerned.
Say in English to Mr. Marino, the best of luck.
Okay, no, but what I say is that it's too bad he didn't respect the rules. I don't know exactly what are the implications juridically about the fact that he had some illegal activities. But what we know is that this coming Monday in Quebec City, we can reopen gyms, but we have to follow the rules.
Can I ask you, Premier Legault, your reaction in the last few days? There were many articles, comments from Anglophones in Quebec and across Canada, this anger about the changes you want to make to the Constitution. Were you surprised? Because at first, you said that it was also symbolic.
But it's not only symbolic. We expect that with these changes, that we can increase the use of French in Quebec. So that's why we did that, mainly. So I understand that maybe some people, some Anglophones disagree with that, but it's clear since a long time that the only official language in Quebec is French. We'll continue to offer services, for example, in healthcare and education in English, but we have one common language, it's French. And it's okay that some Anglophones disagree with that, but that's not something new.
You understand their anger then?
So, on va essayer de rester à deux questions.
We will keep ourselves to two questions. I will ask you to repeat in French what you said to Cathy, and then we will end with another question. I have a question from the internet. What we wanted to do with the changes with Bill 96 is to make sure that French will truly be the only official language and the common language in Quebec. On signs, in studies, at work, very important in work, in the workplace. This is nothing new. There are some new measures that still aim for the same objective that we had under Bill 101. I understand that some Anglophones are not in agreement, but I don't think that this is a new situation.
How concerned are you with the people gathering, like what we saw last weekend on the crowded beaches and the parks? How?
Well, as we said, I think the most important point is that people of all ages, and that applies to the younger people, is that they get a second dose. The real immunity is after the second dose. So I think that, and this is the reason that we are saying that this has to be done gradually, and people need to follow those sanitary measures. And I think we all understand, and I said that publicly, that people are tired, they want to see their friends and everything, but I think we need to think about how important we have the chance right now to have those vaccines. And we're doing this as quickly as we can. So I'm just asking those younger people to do what they have done that very well. And as I said, maybe in French earlier, we got almost 100,000 appointments that were made by the 12-17 since last night. This is great. On a population of 100,000, I think that just showed them that the younger people want to get vaccinated, but they will get the full protection with the second dose. So I'm just asking them to continue what we have done so far and do the good job.
With the fact that Montreal will stay in the red zone for at least one more week, and they see other regions going to orange zone, aren't you scared that people start deconfining in Montreal and like they create their own rules?
But I think this decision that have been taken by public health, I think has been taken not only with discussion of local authorities of public health, and I think they're saying that's the best thing to do in the circumstances right now. So honestly, 1 week out of 14 months, I think it's worth waiting for that. And I know people are tired, but I really think this is the best thing to do.
It's important also to remember that in the 5 zones remaining red, these are the zones where we have the most important number of active cases per capita.
Merci.
Donc, comme promis, une question transmise par...
So a question that came in through the web. The opposition parties have a common standing against the troisième lien. We have to understand that there is a traffic problem between the North Shore and the South Shore. There might be some people who deny that there's a problem, but I think that it's obvious that there is a problem. When we look at the different solutions, there's not 50,000. We can look at a bridge, a tunnel, and we believe that the bridge would disfigure Quebec and Lévis. And we believe that the additional investment to build a tunnel is preferable. And the tunnel that goes from downtown to downtown allows to limit the urban sprawl that we would have with a bridge, and also allows to hope in a realistic way that there would be a significant increase in collective transportation between the North Shore and the South Shore. Thank you very much.